It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So currently we are working with a client who has their 65-year-old mother in ICU for the last couple of weeks, initially with cardiac arrest, supposedly hypoxic brain injury, but she has woken up now. And she's now at the point where she is in a controlled ventilation mode, in an ACV mode, with a rate of 15 breaths per minute, with a PEEP of 5. But the minute they reduce the rate, the minute they try to do some spontaneous breathing trials, she's failing miserably and she's becoming hypercapnic. Hypercapnia means that she's retaining CO2 or carbon dioxide. And if patients are retaining CO2 or carbon dioxide, they become drowsy and their breathing is simply not optimized. Now, the good news about this lady is she's fully awake, right? She's even doing exercises. So the ICU is doing all the right things in that aspect. They're doing exercises with her physical therapy. And she's even marching on the spot when they get her out of bed. But she's simply not in it. And now the client is asking, should they give consent to a tracheostomy? Now the ICU is saying that no, she should have a tracheostomy and a PEG tube and then go to LTAC. And our advice here is that, she does need a tracheostomy because she's simply not ready to be weaned off the ventilator. It's now about 40 days, and clearly all research suggests, that the tracheostomy needs to be done after 2 weeks of the inability to be a critically inpatient sedation, opiates many days ago. And like I said, his mom is fully awake and she's doing all the right things. She's just, for whatever reason, not ready to wake up. They've done all the neurological tests. They can't find anything. They can't really diagnose at this particular point in time whether she or why she has or why she is retaining carbon dioxide and CO2. It is a mystery so far. The only thing that I said to the client is they need to find out if she's potentially got sleep apnea, right? And she hasn't been diagnosed with it yet because many patients with undiagnosed sleep apnea retain CO2 and become hypercapnic. So the moral of the story is that, yes, they should also insist on the ICU having a weaning plan, the ICU having physical therapy plan so she can get stronger, breathing muscles strengthened. They should probably do a sleep study at some point, ruling out whether she's got any sleep apnea or not. They've done all the neurological tests, like I said, CT scan of the brain, MRI scan of the brain, EEG. They've even done a lumbar puncture. So, the ICU is definitely doing what they're supposed to be doing. But the next step is to get on a weaning regime to strengthen her breathing muscles so she can be weaned off ventilator. Now, the other thing that's important here, the ICU is also trying to push for a PEG tube, and this particular ICU is in the US, and the client is in the US, and again, we are strongly advising against the PEG tube. And nasogastric tube will be perfectly fine, right? And she can, be weaned off the ventilator without a PEG tube. There's no need for another type of surgery. So I hope that helps you understand, if your loved one is in a similar situation, what needs to happen. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very confidently say that we have saved many lives for our clients in intensive care. You can verify that our intensivecarehotline.com testimonial section, where we have published client testimonials, and you can also verify that we have saved many lives for our clients in intensive care on our podcast section, where we have done plenty of client interviews, and you can listen to our client interviews there. because our advice is absolutely life-changing. And because it is life-changing, that's why we help our clients to improve their lives instantly, make sure they make informed decisions, have peace of mind, control, power, and influence, make sure their loved one gets best care and treatment always. And that's why you can join a growing number of clients and members that we have helped over the many years, hundreds and hundreds of them, potentially thousands of them. And you can join the list of members and clients we have helped over the years, because I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly, and I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to you and your families directly, I also offer to talk to doctors and nurses directly with you on your behalf. And I ask all the questions to the doctors and nurses that you haven't even considered asking, but must be asked when you have a loved one critically in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.com directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us at one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video, and share this video with your friends and families, or anyone who will benefit from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.